Growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of the Lionhearted, where Dr. Stephen Rasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Hi everyone, Dr. Steve Rasner here. Welcome back to the Lionhearted Dental Podcast. I have a lot of things I want to say to you today. I hope you're listening early on, and I hope you're concentrating. I think I have let you down in the last month or two with the direction of my podcast. I don't even know if I'm supposed to say those kind of things. I don't really care. I've always been straight up with you. I think it's part of the allure sometimes of the way I reach out to my colleagues. I've told you too much of what I think you should do, but not how to. And I'm going to make a deliberate, conscious effort, even if the topic is smaller, to teach you exactly the steps to incorporate things that have an impact immediately on your practice. And I'm going to try that for a while. And if I don't feel connected to you like I don't right now, then I'm going to be gone. It's not a threat. What can I do? I just, like an athlete, I want to perform and keep playing the sport if I think I'm playing at my maximum level. And, look, you don't need to listen to me each week, particularly for me to tell you how hard it is. But it is difficult with this format to come on weekly for now over 3 years. And I realize that some of the principles I speak about that ring very, very true in the United States and Canada, Australia perhaps, but may fall short in the Philippines, Sweden, Iran, Egypt, Kenya, all the places I never thought my voice would be heard. So what I say can't always be translated. Business principles can be. So I'm going to also try to focus, because I know that you listen globally. So I'm saying to you tonight at the beginning of this podcast, which is probably airing in very early March, that I'm going to make an effort, a harder effort, a more conscious effort, as I just said, to give you direction in the 25 minutes that we speak each week to do something that I'm going to recommend. And hopefully that'll make a difference. And I'd love to hear from more of you. If you are listening, let me know you're listening. Look, I can look weekly on my numbers of downloads, and they're not much different than they were a couple months ago. And I don't get a cookie if I reach a new plateau. It's just the only sign I have that my connecting, as well as emails that some of you sent me. So that's my pledge. I guess that's what we'll call this. And I'm going to start it now. I did hear from one of my colleagues, and I like to share it with you because it's a little paragraph. And he said, you mentioned you hadn't heard from us, which I keep telling you lately. I like to say I've seen huge improvements in my practice. I stopped being a toothache or limited exam doc. I insist on comprehensive exams, getting a good set of records. What's most interesting, and I want you to hear this, is now we're doing that. And the unscheduled treatment list of patients from a few months ago has become way more comprehensive in the diagnosis treatment, which means it's more profitable since we do more per patient. That's an interesting thing that I've never really spoken to you about. And maybe I'm in left field, but I listen to really well-known personalities in our industry on Facebook or other social media, and they're absolutely blatant about you'll earn more, you'll do this and that. And of course, I've come on here and told you about $137,000 weeks and things like that. I want you to know something. I have never advocated anything to you just so you'll make more money. I never talk about a quicker prep. I never talk about anything like that because this is what I know. To me, one of your colleagues practicing in the area of the United States, southern New Jersey, that, trust me, is very challenging. You don't have to trust me. Google Cumberland County, New Jersey. Just do it yourself. Look up the economic parameters, the unemployment, the poverty level, everything that I've alluded to. And in that arena, it didn't have a turn down 10 years ago. It had a turn down 41 years ago, the year I opened. That's the absolute truth. And these principles that I've shared with you carried me. And I know they'll carry you. And so some of you right now are in dental school. So I want to make this connected to you. Some of you are in your early stages of associateship. And that is very challenging since you don't control all of the work that you get to do. That's not even true in my own office. I treatment plan all of the cases that come in. And the associates I have, based on their skill sets, help me execute those treatment plans. So it's really challenging to you guys because you can't even put together what you get to do. So what do? Well, for both you dental students and both early associates, which I just said is pretty challenging, this is the time to expand your skill set. This is the time. Yeah, those first 5 to 10 years, you should be taking CE. Now, I tell you this every week. If you want the CE recommendations that I would do if I were you, I will have Beth mail them to you. But the principles every week that I'm out here espousing, a sedation practice, I'll come back to that because that's going to be my focus for the rest of this tonight. Remember, I'm going to tell you how to, not just what to do. It's one thing for me to say, you should have a sedation practice. But if I don't give you any steps that are palpable and you don't do anything about it, then another year goes by and you haven't done anything different. Right? But those of you early on, as soon as you graduate, dental students, it's the beginning. It's not the end. It's the beginning of your CE journey that separates you from the masses of the 188,000 dentists in the United States. Those of you alone. Because otherwise you're going to spend your career doing random operative procedures. You're a tooth filler. And I've been a tooth filler in my career. The more you invest in CE, I don't mean any CE. You have to have a specific game plan for what you want to become excellent at. You have to sit down with yourself, and there's no mistake or there's no waste of time in you starting a journey and realizing it's not for you. So you could start, for example, to think that you want to train in ortho, right? You can start taking ortho courses. And then maybe that's not going to be for you. You do whatever reasons. As you get closer and more involved in those skills, it doesn't reward you. It doesn't, and that's the bottom line of all this. But I'm just going to say one more thing before I get into my main topic tonight of the first thing I think you need to focus on, and then what you need to do to get there. I want you to remember this doctor who wrote to me. The change that he made are two changes. He began to do comprehensive exams, which many of you just refuse to do, or maybe you don't know how to do it. You want me to give some more examples. If in my early podcast, that's what I used to talk about. I'll do it over again on not how to do case presentation. I've been talking about that in the last couple podcasts. I'm talking about how to diagnose and then treatment plan appropriately, because it's very different for each patient. And there's not one way to do it, but there's many ways not to do it. And if you did go back to my early podcasts from 3 years ago, there's like 5 in a row on how I approach diagnostically the new patient. What are the 5 arenas I look at? And look, I labeled this podcast the Lionhearted Dental Podcast. And I did that because I thought I was giving you an example of an amazing way to reach your maximum potential, no matter where you're located, even if you are in an area more challenged in the United States. So, although I've talked about it many, many times, the topic I want to talk about tonight is the number one target I would go after if I was you, and it's the oral sedation practice. Now, don't turn me off. Even if you've heard me say this 10 times, which I'm sure I've said it more. Why would you not do that? I hear myself saying to my new patients in the operatory that I'm not sure why more of my colleagues don't do that. Because where I practice, think about this for this very fact. Some of you are listening right now all over the world. I don't know what your requirements are in the Philippines, Hungary, Singapore. I don't. I know some of the countries are very much like the United States. Let me be clear. In the United States, in most of our territories, most of our states, you have to take about 60 CE hours to get an initial permit that allows you to give multiple medications, which I have in my Lionhearted oral sedation protocol. So my oral sedation protocol is Benadryl, Atarax, both antihistamines, I get it, triazolam, and nitrous oxide. Now there is a lot more to it than that, but they are the 4 influencers I use. Benadryl, Atarax, I think it's 50 milligrams of Benadryl, 25 Atarax, 0.25 triazolam, and nitrous oxide. And now I'm not going to go into it now because I'd gladly have Beth mail you the sedation protocol that I've been advocating for 26 years. Do you know I'm looking you in the eye right now if you were watching me? And I'm able to look at you and say, I've never had not one episode of a untoward event by giving that cocktail. Never once have I had to call 911. Never once did I get uncomfortable because vital signs were odd, or I couldn't wake a patient up, or the patient became sick some way. Clearly, there are some patients that need more than internal sedation. I get it. But I got to tell you, I haven't done a math analysis on it, but it's above 95% that it's effective. Very effective on. So what is stopping you? Here's what I would do tomorrow. You tell me when I get done saying this to you, what do you have to lose? Even if you've heard me say it many times, do you not do it because you're afraid that something negative will happen to that patient? The answer is no. It's not. It can't be lucky with me. And I don't like to get on an interview or on this podcast and make up a number. But I mean, I've done it every single day I practice. That's 4 days a week. 2, if not 3 times per day. So if it was 2 times a day, that's 8 times a week times 50 weeks is 400 cases a year times 20 some years. I don't know what that comes out to, but I've never had a negative. I haven't even had anybody fall. I mean, they do get up and go to the restroom. We're escorting them, and I would gladly give you all the details. I'm not selling this to you. I'm advocating this so it impacts your practice like so many of my colleagues. Really not enough of my colleagues, quite honestly. And maybe it won't work in some regions of the world that are listening to me, because I don't know what the restrictions are. I can tell you, even in the United States, there are a few states that will require you to get a IV sedation permit, which is much more comprehensive, obviously, the training, even if you want to just give out oral sedation. And I would tell you to do that. I would. I would tell you that the impact is so incredible on not just your practice, but your everyday to-day experience as a dentist is so incredible when you get to provide dental care while the patient is somewhat sedated. Significantly sedated, I should say. Now, either I'm a big fibber or I have stock in Benadryl or triazolam or nitrous oxide, which is kind of a ridiculous statement. I get it. Or I just really want to help you. And it's the number one thing I would do. Because here's why. No matter what stage of dentistry you're at, private practice, getting out of dental school next year, an associate for sure. Do you know the impact you would have as an associate if you could state that your corporation or your boss could start advertising that they do conscious sedation? It's just, and then what, and I want to say something to you. This is an aside. I don't know, maybe I have more time, maybe I'm getting older. But I have thought recently, why is it that Steve Rasner, is so connected, so fervent about what we all do each week as a profession, 40 some years into doing it? Why? And I know why. And here's the truth. Because it does feel a little bit, this could be the end of you listening to me, some of you when I say this, but I'm just telling you how I feel. It feels heroic sometimes when you complete a case on a patient, which is every day for me, or I start a case on somebody that sat in my chair 3-4 weeks before and told me a story about why they didn't have dental care, or cried when they were there at the initial visit. Many. And heard about my practice, which will be your practice. It's not unique to me. It's not really even unique to any skill set you have, other than your responsibility to keep the patient safe, which I cover all that stuff for you if you want to know more. I really don't understand why more of you wouldn't take this path, because I want you to think for 1 minute before you go. I want you to picture in your head, I want you to picture going into a room. In my case, I mean, as I've gotten older and realized what I really like to do and what I don't like to do, I have that luxury that some of you don't have, because you don't have enough time in, that I have my patients anesthetized really before I go in the room. And they vital signs, and I mean, I delegate everything. I'm lucky to have my staff and team with me quite a long time. And there's an amazing amount of trust and benefits that go in to that relationship when you have people with you so long, right? So I absolutely trust that they would do it exactly the way I do it, including the local anesthetic. Exactly. The 2-needle technique with Citiness 4% plain first, so the second shot doesn't hurt at all. And the first one, you can't feel that either because Citiness has a neutral pH. By the way, that's my painless injection technique that I learned 30 years ago from Bill Strupp. I still use it. So they know that. They're doing it exactly the way I do. And I walk into that room, think about this. It's dark, which is a chill factor. It's kind of cool, right? I got the music I want playing lightly in the background. My patient may have headphones on or listening to what we have. Their vital signs are being monitored by a pulse oximeter, and they're snoring. This is what I want you to picture. And I sit down, scrub, or regular preparation for a patient that's not surgical. Have my gown on. Tap them on the shoulder lightly. And they wake up a little. And I say, hey, it's Doc. I didn't want to scare you. I'm getting ready to begin. Put a bite block in their mouth or isolate. And do the procedure. And universally, my work is better because I'm not working on somebody that compromises my techniques or my skill sets because I'm worried about managing them because they're upset and they think they're feeling it. You know, do I ever have laryngospasms and things like, of course, but so insignificant. And then you finish like it's the 4th visit and you're done, not the 1st visit. And you do so many cases that you actually forget what the patients, even the hardest ones, were really like. I wish I could tell you that it was just me. And I'm really good with managing people. And my voice is appropriate. And I know many of you could absolutely duplicate what I have. And then we haven't even talked about the built-in, unbelievable advertiser army of people you're creating in your communities. It is the fastest way to build a practice. It is the easiest way. It's the most inexpensive way. And it's the best way for you to spend the 8 hours a day or whatever hours you choose to be a dentist because it's less stressful. And no matter what I'm saying right now to you, no matter how many of you finally go out and find out this week what's required in if it's in Canada, I think it's a little different. It's probably different in the other European countries and abroad. But there has to be channels in place, legal channels, wherever you're practicing, that will enable you to get to some part, to get a permit to allow you to provide better care. And that's the number one thing I've given you right now in 2022 that you should go after. Even if you chose, for whatever reason, not to do it, which I can't imagine why you wouldn't do it. Maybe there's dentists listening to me right now in southern New Jersey. Then you would impact my practice if you copied me. So 60 hours, I don't know, that takes about 4 months, I guess, followed by 20 hours every 2 years. In the United States, we have this association called the docs, and I think their formula and mine is pretty similar. We were using, I believe, the 2 antihistamines. I don't think they always use that. And there's a reason for every component, and that can be mailed to you. Look, this is going to be my charge as we move forward in 2022. Each week I'm going to come on here and be very specific about the next step and how to do that next step. I would like to come on and tell you oral surgical secrets, like how to really get teeth out. I don't know whether that would translate enough if you're only listening to me on audio and not visually. And for goodness sake, it's not why I'm saying this, but there's a reason that the courses I chose to give live in my office are atraumatic oral surgical extractions and also in implants. And do you know when I give those courses, I implore you to not do everything? I tell you not to do wisdom teeth because the morbidity associated with taking third molars out versus second molars, what are they, 15 millimeters from each other? But just one tooth measly is much less chance of complications. So I don't even want you to do everything. And when I teach you implants, I want you to do the easy ones. Why would you not want to do the easy ones? Abundant bone patients, patients that don't smoke, patients that aren't borderline diabetics. There's plenty. You know how wonderful it is to have a patient call you and come in, break off number 7. For those of you in other parts of the world, I guess that would be 1, 2, and not even blink and be able, in your repertoire of skills, because I pushed you to take CE or you pushed yourself, and you take the tooth out atraumatically, place an implant, load it. It's so rewarding. I just can't imagine, even if you do the most beautiful veneers and cosmetic dentistry, which certainly is a big place in my practice, it's different when a patient loses a tooth. Think about if you lost a tooth. Yeah, you had some sports injury or something, and you lost a front tooth. Who would you go to? You'd want to go to somebody you really trusted. Well, the only way to become that person that they really trust is to invest the time in the skill sets. And the first skill set is sedation, because it makes you a better overall dentist, period. I hope this is the beginning of a new trend. I hope I'm on this podcast 6 months, 2 years from now, whatever. It hasn't felt that great to me in the last couple, and that's my own fault. Maybe I got complacent, I don't know. But I'm not going to be anymore. Either we're going to do this, we're going to do it right like we always have, or there's many more other podcasts for you to check out. So thanks for listening. I mean that. Mean it tonight more than I ever did. And I'll see you next week on The Lionhearted.